And it is time for Wellness Wednesday with Dr. Bradley Meyer of Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, Dave. Good morning to you.
You know, it's interesting since we have begun Wellness Wednesdays and you have brought up different topics. It's like when you buy a new car and you think, wow, I've got the only one, and then you hit the highway and you notice that everybody's got the same car. When you have brought up things like grounding and gut health, some things we haven't heard a whole lot about. And now I find myself looking at other doctors that I follow. And for example, one this week, 80% of your immune system lives in your gut. That's extraordinary.
It is extraordinary. It's so much starts there when we come in and sit down, and most folks kind of just get used to living with it. The belching, the bloating, the heartburn, and they'll pop their tums and not realizing that's kind of the genesis for a lot of problems if we're just covering them up with antacids as the answer all the time. So again, sometimes like when folks have an ulcer, do we need a proton pump inhibitor to decrease acid in the stomach? Yeah, I mean there's a time and a place, but in general, we want to get that gut and that digestive tract humming as much as possible on its own, just with what we eat and what we don't eat. So, lot there.
And just like you, this doctor talks about those medicines certainly are a Band-Aid, but if you want to get to the root cause, you're probably going to need some lab work and see exactly what's ailing you and how you yourself can take a proactive role in healing yourself.
Absolutely. So I'll have folks that will come in to see me at the Okoboji Wellness Clinic that will sit down for a long visit, and that's sometimes 30 to 60 minutes, and we will get a full history, and then I will see what labs have been done. And the interesting thing, you've probably had some labs done at your primary care provider in the last year, and the parameters that are set on these labs many times are quite wide. And so what we want to find is the optimal spot for your blood work to be in, not the just okay. And that's one of the things. If we need a little additional blood work, broader range than what was gotten at your primary care office, I may add some additional labs to it. Something like a uric acid, and a uric acid is something that over the years has been associated mainly with gout. And so gout is when crystals develop in joints in the body and lead to a really bad sore foot or joint. And so a lot of times if that uric acid is checked at the doctor's office and it's under 7, then we're told, hey, we're good. But that means we're good from a gout perspective. We're less likely to have a gout attack. But we really want that uric acid to be under 5.5. Again, that's a blood marker, and it can it's a big measure for a lot of things, including inflammation in the body. So many times we'll see if in fact there was a study that came out in the 70s that showed that there was I think it was around a 25-30% increase in it was 18% all-cause mortality over a course of 8 years. So increased death rate for folks that had an elevated uric acid over 7. And so, but the things we think about a lot of times that can elevate uric acid and lead to a gout flare, things like beer is one thing. Sometimes it's purine-rich foods that can be, meats, specifically seafood, scallops can have it. But there's a whole list of things, the foods that have this high purine. But one of the big things we don't think about is fructose. Fructose, which is a sugar, is hugely impactful on elevating uric acid. So when that uric acid goes up, not only do we potentially have problems with gout, but we have problems with blood pressure. We have problems with memory and dementia. So we really want to get that marker down. And that's what you come into the clinic here, and we talk about, oh, well, how do we get that marker down? Part of it is what you do and don't do at home, and that's cutting out the sugar. The refined sugar is such high fructose corn syrup that came along in the 70s it's a hugely inflammatory thing. In fact, I had a young man in here in his 40s that said that in the last month he's cut out his refined sugars, and he had come in with a lot of pain, chest wall pain, just body aches. That alone, he was able to get rid of almost all of his pain, just cutting out the sugar. So again, going back to uric acid, sugar or fructose fuels the uric acid level, which increases your blood pressure. So there's a lot of ways that we can go about. If you want to come in to try to get off of blood pressure medicine, that's one of the things we're going to look at. Some other things we think about is magnesium, as a lot of times people are deficient in that. But there's a whole host of things that go on, including your nitric oxide level as well, that is many times affected with an elevated uric acid. That is also a factor in blood pressure. So lots of things when we want to take that deep dive to say, yeah, doc, I'm on these pills, I'm still not feeling great. What can I do to try to wean off of these pills and start feeling better? More energy, less brain fog, less pain. Those are all things that we're trying to accomplish here, and we're having some great wins with the folks that come visit with us.
The other thing that I have noticed is a lot of these doctors, they are moving to a direct primary care model. They do not want to be held hostage by the insurance industry. They want to treat people for the reason they got into medicine. They want to help people.
That model, the direct primary care model, which is a monthly membership, it's a really good deal. It's $179 for a couple, $99 a month for the individual, and we have family packages as well. It's like having Doc Meyer in the back pocket. So what you end up is you got unlimited visits per month, and we can work on some of these goals to get healthier, get off of less medicate, or get those medications weaned down, and longer appointment times. So I'm not bound to a 7-minute appointment time, because I've got about a smaller empanelment size of folks that come see me on this capacity for this membership, so I can take more time. So we can really, really work to get to the root cause. So it's a unique opportunity for folks in Northwest Iowa that's available in some of the bigger cities, but it really can help you get better faster, because we can accomplish more in a 30 to 60-minute visit to really, really dig deep.
All right, so how do people find you and get on their way to living daily better?
Yes, you can give us a call and make an appointment if you want to learn more. You can stop in at any time. We'll give you a tour of the facility, because this is an integrative medical practice. So it's 712-339-6024. And we've got a whole bunch of pieces to our team. The hyperbarics, we had another win this week with a wound that healed up for a young man that now was able to get closer to being able to get a prosthesis fitted. And so that was a beautiful, beautiful high for us this last week. So, yeah, come check us out. We're at 3305 Berquist Avenue, which is just north of Ace Fix Hardware off of Highway 71 in Spirit Lake.
Very good, Doctor. It's always a pleasure. You have a wonderful day. Enjoy this mid-50 day. That's going to be a new record high, probably. So you can get out and do some grounding today.
Get some grounding done, give us a call, and get started on your wellness journey.
All right. Thank you very much, Doctor.
Thanks.
Dr. Bradley Meyer, Okoboji Wellness Clinic, here on Wellness Wednesday.